It's that time of the year when hospital outpatient departments begin to see an increase in patients experiencing breathing problems and asthma attacks in areas across Delhi NCR. Indeed, it is the season when air quality worsens, often hitting its lowest points. According to weather experts, a thick haze has settled over the city with the air quality index ranging from 250 to 350, indicating very poor air quality that may cause breathing discomfort. What's more concerning is that the AQI in the national capital is expected to worsen this week. Doctors have already started witnessing the rush of patients. In the last week, several patients with a history of respiratory illnesses like asthma and chronic obstructive pulmonary disease, also called COPD, are coming with increased breathing difficulties, wheezing, and chest tightness. Delhi-based Dharamshila Narayan Hospital has seen 25 to 30 patients in the last week coming with asthma-like symptoms. Not only asthmatics but healthy people are also falling ill. Doctors told us that due to poor air quality, healthy patients are also coming to the hospitals with complaints of itching in eyes and dry cough with nasal symptoms and throat irritation. Many doctors shared a similar observation who told us that people who never had any history of breathing disorders are coming with cold and asthma-like symptoms. Now, who is most affected? Children and elderly are the most vulnerable. Experts told News 18 that they have been witnessing an increase in the need for nebulization and other respiratory medicines in the last few days. Doctors have noticed that vulnerable populations such as children, elderly, pregnant women and individuals with pre-existing conditions like asthma, COPD or heart diseases need to be especially cautious. Polluted air is known to aggravate respiratory and cardiovascular conditions, potentially leading to severe complications. Doctors warn that things are not looking good for people in areas around Delhi NCR in the days to come, especially around Diwali, and may trigger more symptoms. Dr. Maninder Dhaliwal, who is an expert in treating kids at NCR-based Amrita Hospital, has been seeing many children, in fact, with respiratory issues in his outpatient department, inpatient department, and even intensive care unit. But he says that the increased rush of kids can't only be attributed to pollution. Other factors contributing to these can be changes in season, changes in allergic substances such as pollen, more viral infections, and cold, dry air, which is typical in the winter season. Now, what are the tips to survive air pollution? It is important that the public take preventive measures such as wearing masks outdoors, using air purifiers indoors, avoiding physical exertion during periods of high pollution. Doctors suggest that the public must recognize early symptoms and seek medical attention if breathing problem worsens. In short term, it is recommended limiting outdoor activities, particularly during peak pollution hours, typically in the early morning and evening. Wearing an N95 mask when stepping out can provide some protection. For those with respiratory conditions, it's crucial to keep inhalers and other medicines handy.
Since winters are settling in, what we are seeing that there is an increase in the number of patients with persistent cough, breathlessness, nasal symptoms, respiratory tract infections, upper respiratory tract, lower respiratory tract, pneumonias, and also patients with pre-existing lung disease like asthma, COPD, they are having more symptoms and having asthma attacks. Even normal individuals are coming with persistent cough and breathlessness. Those with high risk like children, elderly, and those who have pre-existing lung disease or cardiac disease, kidney disease, diabetes, hypertension, they are more at risk. And these patients should take precautions in this increasing pollution in the atmosphere.
Hello everyone. With the advent of the winters, there has been a surge in the AQI which has gone past 350 now. Patients who are coming to our OPDs are coming with chiefly respiratory symptoms. Both elderly and the young ones are severely compromised in this situation. The elderly persons are getting symptoms of wheezing and breathlessness with cough. The children who are coming to the OPDs are getting nasal symptoms, running eyes, with these symptoms. There has been a surge in the use of medications which are anti-allergics, and nebulizers are being used very frequently now. The emergencies are also filled up with patients with acute respiratory symptoms, allergic symptoms, and with the passing of time, the winters are going to be harsh and the situation is going to be bad. So people should take care of themselves, take plenty of fluids. Elderly should avoid early morning walks. They should do deep breathing exercises, and if the conditions are not under control, please visit your nearby physician or respiratory physician as soon as possible.